Good afternoon, and thank you all for joining me on a Sunday. Delighted to have our Commissioner of Health, the one and only Dr. Mary Bassett, who has been on the front lines with us since almost since the beginning of our administration. I want to thank her for her incredible leadership as we talk about COVID. But before we get there, we need to step back and acknowledge the fact that there is a war going on in the Ukraine. This is an unprovoked war. It is an issue that we take strong exception to. In fact, we strongly condemn the action of Putin and Russia for this unprovoked attack, which is now leading to atrocities against innocent human beings. And that is not tolerable. This is the state of New York, and we are the home to the largest Ukrainian population in America. These are our fellow brothers and sisters. We worship with them. We go to restaurants with them. We celebrate their cultural festivals. They're an important part of the fabric of New York State. So an attack on their country is truly an attack on all of us. And I want to say we are grateful to President Biden for his global leadership. This is a time when the country should be united behind our president, because we're having an attack on democracy, the likes of which we've not seen since World War II. So we forcefully condemn these actions. We call for an immediate resolution. Let the people of the Ukraine resume their normal lives instead of having to flee for their safety and create a situation. We now have nearly 400,000 refugees. We have said we'll open up our hearts, our homes, our resources to the people of the Ukraine to say, we stand with you. If you need a place to stay, you want to come over here, we will help you become integrated into our community, as we have been open to so many other refugees in the past, including those from Afghanistan most recently. Because we have the Statue of Liberty in our harbor, this is a point of pride for us to welcome all of them. And also not just welcoming the refugees, but as the governor of the state of New York, as the 10th largest economy in the world, larger than Russia, we realize the unique power that we have to join President Biden in economic sanctions, as well as to look at exactly our operations. I mean, are we taking any steps with our agency, our acquisitions, our investments? Are we in any way supporting the government of Putin and Russia, who are now attacking democracy in Ukraine? So we are no longer going to allow New York State business to be transacted with Russian entities. This is a testament, again, to our strength, but also I'm going to be signing an executive order. And what this executive order is going to do, and I'm going to read part of it here. Whereas Russia and Putin have engaged in an unjustified and unprovoked attack on the sovereign nation of the Ukraine. Whereas the state of New York is home to the largest Ukrainian population in the United States and is proud to have this special relationship with the nation of Ukraine. Whereas New York stands firmly with Ukraine and strongly condemns Russia's actions against the country. And whereas the state will not permit its own investment activity, whether directly or indirectly, to aid Russia as it commits these human rights violations and atrocities. And whereas this order is a testament to the values and the economic strength of New York State, which is a higher gross domestic product than all of Russia. Therefore, I, Kathy Hochul, as governor of the state of New York, do hereby order, effective until such time as the sanctions imposed by the federal government are no longer in effect, that we are going to be reviewing all of our state purchases, all of our investments, and seizing all of those investments until time of such further notice. We'll be calling on all divestments from state money. We're working with our comptroller on that, as well as investments in any company or institution that is on a list of Russian headquartered entities. So we're going to also continue to refrain from any future investments. This is a strong statement. It is a statement of our priorities. It's a statement of our values. And that's why in the next moment or so, I'm going to be signing this executive order effective immediately, again, commencing a review of all state investments and purchases and ensuring that anything related to companies headquartered in Russia or Russian state-sponsored entities, that they will cease immediately. That is how we're going to take this strong action in our condemnation of the actions taken by Putin and Russia. And our hearts go out to the people of this country that is under siege and to all their family members who live in our state, and we will continue to protect them. We have protesters in support of this effort out front of our Capitol. We stand with them as well. And let all New Yorkers and Americans show our solidarity with our country at this time and stand up to this assault on democracy. Now we're going to shift into a different topic altogether because while we talked about the war that is going on not far from here in the Ukraine, unprovoked, the aggression by the Russian government, we still have another war that has been unfolding for the last 2 years where our country has been under siege by this unseen assailant, but is one that has taken thousands of lives of Americans and New Yorkers. And so our priority since the first day has been to protect the health of New Yorkers, to protect the health of our economy, and in particular, as I said on day one when I was first sworn in, I said our priority is to get children back to school. If you recall back in August, early September, there was a lot of anxiety from parents and teachers and administrators. Is it safe to send our children back to school? But we knew one thing for certain, that the experiment of remote learning had devastating effects on the educational quality that the children were receiving, as well as the effect on parents and teachers. This stress was incredible in terms of what our citizens had to endure. So in order to make sure that we got back to the classroom where learning should be occurring, we took a step at that time, literally my first day in office 6 months ago this week, and said that in order to ensure the safety of our environment, get children back to schools, protect everyone in that entire system, we would require that masks be worn on children at that time and while they're in school. And yes, we withstood a lot of criticism, a lot of objections to this, but we're going to talk about where we came from in that last 6 months, and you see the spikes in the infection rate that really validated the rationale and the logic behind ensuring that we had those masks in place through those spikes, especially the Omicron variant. So let's talk about what we see now. On January 25th, let's just step back even a short time ago, we had the winter surge. We had a talk about how we were going to handle this as children were coming back from the vacation, the winter break they had with their families over the holidays. And we saw that the numbers beforehand were starting to spike. We had taken dramatic steps to decrease them. And we said that at that time, as the numbers start coming down, we're going to be very logical about this. This is not just an instinct, a reaction, just a gut feeling of when you have a mask on or not a mask off. You do it based on listening to the experts. You do it based on metrics and data that are reliable. So I said on school masking, the question of school masking, which we've been asked about frequently, we're going to monitor the metrics, also specifically looking at pediatric data, get the test into schools, which we did before the break in December, and as we said we were going to do before this winter break as well. When the children come back, they will have plenty of opportunity to be tested. So we distributed literally millions of test kits to students in schools, as well as consulting, as you saw we did on the Zoom call, consulting with members of the educational community whose voices need to be heard. Our Commissioner of Education, our parents, PTAs, our school superintendents, our school administrators, our unions that represent the teachers. We talk to everyone first, we involve them, they understand what we're doing, and they agree with us. So let's talk about some of the metrics I said we were going to examine before we would make a decision on the removal of masks in schools. Positive cases. That is a graph we've been showing for considerable time now. A lot of anxious days. The latter part of December, we were in this very room on Christmas Eve. We were here New Year's Eve talking about what was happening with the spike in infections. In fact, on January 7th, we had 90,000 positive cases in the state of New York. That was quite extraordinary. Now look where we are today, a 98% drop in cases based on the number from February 26, yesterday's data. That's an incredible journey that we all went on together. But I'll tell you, when I look back at what was going on just a short time ago, I am so happy that we did have a mask requirement in place for schools. And at the time, we even had a requirement for 2 short months for businesses to make sure that their customers and patrons and employees were masked or vaccinated as well. That's how we kept these numbers from getting even worse. And so putting this in the context of our state population where we are today, we have 1,671 positive cases out of a population of nearly 20 million New Yorkers. So you have to look really hard to find that one little person who represents the 0.008% of New Yorkers who tested positive for COVID. My friends, this is an extraordinary slide to look at to show how long and painful this journey has been for the last 2 years, but this is where we are today. We also talk about not just the drop from the peak, but are we sustaining these numbers? I mean, was this just an arbitrary drop and it's popping back up? No, this has been sustained. 51 days of a downward trend, and that's what we are looking for as well. So again, watching trends outside this country, seeing if there's any opportunities for more variants to be developing. We've been watching this so closely with Dr. Bassett and her entire team, and this is where we are today. Same thing with the trend in our positivity rate, 7-day average, which we watch closely, again, not paying attention to one day's spikes up or down, but the whole 7-day positivity rate is going down. And for February 26th, it is 1.7%, down from 23% on January 2nd. That, my friends, was a very scary time. I think we all remember that. And that has been a consecutive decline of 57 days. Again, another extraordinary accomplishment. Always watch the hospitalizations. This was my nightmare when we were starting to see hospitals overcrowded again, evoking those horrific images we saw in the early months of the pandemic 2 years ago, when the hospitals were overflowing. We didn't have enough ventilators. We didn't have enough protective equipment. We were scouring the earth in search of something as basic as a mask or a gown. And we were concerned about that impact on our capacity. So we started taking steps earlier, monitoring hospitalizations, monitoring capacity, looking at hospitals that were not doing as well, sending in reinforcements. Literally, the National Guard was called in to help some of our hospitals and our nursing homes. And you look at where we are in terms of hospitalizations, 48 straight days of a downward trend, down from over 2,000, almost 2,000 cases just a short time ago. And we've seen an amazing drop just in the last few days. So that is another positive dynamic. And we did lose 20 New Yorkers. 20 New Yorkers still leaves families with that open wound in their hearts that they lost a loved one due to COVID. And we'll never forget the individuals that succumbed to this deadly virus. But overall, we do see a downward decline in all these regions. There was a time, December 22nd, 29th, January 12th, we were watching those numbers go upward and trying to work so hard with our Surge and Flex plan, getting more support in there, allowing more contracts to hire flexible staffing opportunities. So we put everything out there in order to make sure that we could handle our hospitalization. That is a very, very positive trajectory as well. So we're very pleased to see that. Vaccinations. This, as we've said from the beginning, this is our tool on how we beat back the virus. And I want to thank New Yorkers from every corner of the state for doing their part, roll up the sleeves, get that shot, and make sure that they were safe, they protected their family members, and protected our way of life. I mean, all those vaccinations have made a true difference in our ability to get back to normal. And we had basically a military-style operation to get more children vaccinated as soon as they were allowed. The first dose, the second dose, and if you look at our numbers, I am really proud of how we've done here. Over 95 plus New Yorkers have had at least one dose. 85.5% have had their series complete over age 18. And so I'm going to show you some calculations here, but I'm really proud of this graph. We are number one among all large states in having fully vaccinated teenagers. We are number two in all large states for having fully vaccinated 5 to 11-year-olds. We're just a little bit behind Illinois, so I think we can surpass this. We like to be number one in everything we do. And also among the large states, the fully vaccinated total adult population right here. We also now, we've talked about, this is our overall state snapshot, what we've been monitoring, where we are today. But not just looking at our normal metrics, we also examined very closely what is going on with our children, and that's what I want to show you next. 7-day average cases, children 5 to 18. Again, look at where we were on January 10th. Let's go back to the start of the school year. We had 832 cases when we first instituted our mask requirements for kids. We went up to 14,167 cases on January 10th. That was, again, a very scary time for families, seeing that there were a lot of children becoming infected with this. Not many children were vaccinated at the time. We were anxiously waiting to hear when we could do the younger children. And now that number has been reduced to 229 cases. We're at our lowest point in pediatric cases since July of 2021, and that was before the school year started. So this has been our trend over this school year. So as you can all see, looking at the data and the evidence that we followed, that we are in a much, much better place. Pediatric hospitalizations, one of the last metrics I want to look at. Start of the school year, we had about 8 cases. At our peak, we had 38 children hospitalized, and now we have 7. So you can see the drop-off down about 80% from our peak. So that is, again, a very positive trend. So as I've said all along, leading up to this midwinter break, which is just concluding, sorry kids, happy parents, unhappy kids, the break is about to end. And so our priority has been keeping kids in school so there's no disruption, and recognizing that we also have to do a lot more to help the children who did suffer psychological and emotional impacts because of the isolation they endured. So we're very cognizant of that, and that's a different issue for another day, but we have significant dollars in our budget to really help address that within each of the school systems. But keeping our kids safe and in schools meant we set out test kits. 4.8 million test kits were sent to children before the break that we're on right now. We have another 4.8 million being sent this week, and we have over 20 million, 0.8 distributed statewide. And the good news is we have quite an inventory. You know, we amassed over 92 million test kits, so we're going to continue testing. We have plenty. We'll never have a shortage because we took a very aggressive approach to making sure that we were never left vulnerable to supply chain issues, which other states have now found. So that's where we are on test kits. So just to recap, we've reviewed the data, the trends, again, getting a lot of test kits out, making sure that we're listening to the experts. And on Friday, some of the experts that we listen to are members of the CDC. And in consultation with school experts, as well as people who are engaged in the whole ecosystem of our school system, we talked about what was announced by the CDC when they announced new guidance on masks. So the CDC, just at the end of the day on Friday, surprised a lot of people, but came out with their risk assessment by county. And this is an important dynamic for us to talk about. It looks complicated, but based on indications that they look at, infection rates as well as admissions, they've come up with a calculation of what constitutes a low, medium, or high community level. And 70% of the population right now lives in an area that's considered low to medium risk. And that's very positive. And in low to medium, their recommendation is that there's no longer a requirement that masks be worn indoors, and that includes schools in low and medium risk areas. So given the decline in our rates, our hospitalization, strong vaccination rates, and the CDC guidance, my friends, the day has come. Today we are going to be announcing that we'll be lifting the statewide mask requirement in schools, and that'll be effective this Wednesday, March 2nd. So why are we waiting until March 2nd? This came out at the end of the day Friday. We took the entire weekend to work with our Department of Health and our team here at the Chamber, as well as reaching out to the teachers, the PTAs, talking to school superintendents, and even our Commissioner of Education, Betty Rosas, who's been so embedded in this issue with us, and what an amazing partner she has been. So we wanted to make sure that we had the advice and the wisdom of all these different groups that are really directly affected by this decision. And in touch with them for a number of days, they let us know that yes, students are coming back, but a lot of families are still on vacation until later tonight. A lot of people work in the school system are not back, so they wanted a little bit of time to assess guidance that we are working on. It'll be out very shortly, again, in consultation with these school leaders. This is how we do it here in the state of New York. But we believe that by Wednesday, we'll be able to have a situation where we'll have the lifting of the mask requirement, and children, that includes children who are in child care centers ages 2 and up who are covered right now. Now, this is an important point to make. We will lift the statewide requirement based on all the data that I've just outlined. However, there are some states, some counties in the state of New York where they have a higher rate of transmission. We will allow them the flexibility to determine what's best for their county. We would encourage them to take a look at this and follow the CDC, but this will no longer be a mandate. not just the county zone. We're leaving it up to the counties now. Also, this is up to parents. Individual parents have their own knowledge of their children. They know their own children's health. They know their tolerance for the mask. They know whether for them, if they've got an underlying health condition, that they would want to keep the mask on. But again, this is about what the parents now want to do beginning Wednesday with respect to their children's health. But I want to send a loud message that we will have no tolerance in our school system or anywhere for any harassment or bullying of any child or their parents, because social media is also a platform for bullying adults and children. That we will not have any tolerance for people who are questioning someone's own personal decision to do what they want. If people want to continue wearing masks, they're allowed to continue wearing masks, and I don't want any issues related to that, and I want to be very clear on that. We will not stand for any bullying or ostracization or harassment of an individual or a business or anyone who chooses to wear a mask as we're still going through this. And we are going to remain vigilant. We're going to continue distributing masks. We're going to continue distributing test kits. We're going to continue aggressive vaccination strategies, making sure that there's plenty of opportunity for anyone, including our students, to be vaccinated and boosted. And also, we are developing an early warning advance system through wastewater surveillance, an area that is fairly new, but we can monitor whether or not there's any spike in cases. Even if people aren't getting tested as much, we'll have at the Department of Health the ability to analyze this. And we're going to keep an eye on global trends. Again, there was talk last October, November, the numbers were starting to decline. That was good. Do we really need the requirements in place? And then Omicron hit and was first named on November 26th. First case in New York State was on December 2nd, and you know what happened after that because we've been talking about it nonstop. So let's keep an eye on the global trends as well, and we need to retain their flexibility to make adjustments as needed. But for now, this is a very good news announcement that we're going to allow the cessation of statewide mask mandates in schools. Here's the areas we're still going to have mask requirements in effect for the time being. State-regulated healthcare settings, state-regulated adult care facilities and nursing homes, our correctional facilities, homeless shelters, domestic violence shelters, and as the federal government requires that they continue to be instituted on trains and airports, airplanes, buses, and train stations. So what I have done with respect to these categories, because we're focusing on this children's masks in schools today, that I've called for a review of our cases in these specific settings. And within a short time, we'll have an analysis of whether or not, in fact, these are areas that remain vulnerable or whether or not there's been a plateauing and then a decline in cases over the similar amount of time. So I just want to make sure we have all the data available before we would end masks in these categories as well, but that is currently under review. So this is a huge thank you to all the school districts, the superintendents, the school boards, the administrators, the principals, the teachers, the parents, and the children themselves. We stood together as a state. This was a difficult time. There's a lot of people questioning what we're doing, but I always had that sense. If we stick with the experts and the data and let that be our guide and not let criticism and politics intervene in this decision-making, we'll end up in the right place. And that is why I feel very confident that this is the time to lift the mask requirement. And I want to thank all the parents and everybody who have been through this. And with that, I do want to just acknowledge Dr. Betty Rosa, our Commissioner of State Education. If she could just share a couple of remarks. Dr. Rosa?
Thank you. Thank you, Governor. First and foremost, I want to thank the Governor and her staff for leading us through this work, along with our Chancellor and our regents and all the cooperation. We have been truly working on behalf of the children of the state. Governor, your leadership has provided these opportunities to support our districts, our schools, our communities by providing a roadmap, by providing guidance, and allowing us to create a seamless process, creating one voice on behalf of students and families in this state. And for that, we are so grateful for your leadership. And we will continue to do this work together in a collaborative manner, knowing that at the end of the day, this is one state that you have made a commitment that it is truly our work together that makes a difference. Thank you so much.
Thank you so much, Commissioner, and I know you'll be on a call tomorrow morning with our Commissioner of Health, Mary Bassett, to make sure that we put together, conclude the guidance, as well as put together frequently asked questions, so we can have an opportunity to hear what those questions are in real time, but then to provide to school districts and to parents on websites all the anticipated answers to questions they may have, and if there's more questions that we didn't have, we'll be happy to answer those as well. So we wanted to just take an extra, 48 hours here to give an opportunity for more information to be fine-tuned, so there's no questions. Dr. Bassett, did you have any comments about that?
No, just to comment that we have been working actively with the Department of Education, and I very much appreciate Commissioner Rosa's engagement in this process. They're going to be responsible for implementing this, and we want to make sure that we have done it with one voice, as you both have said.
And again, this is the dream team we've assembled here in the state of New York. Dr. Bassett, my entire team, the administration, our health team, but also that collaboration with our Commissioner of Education is really quite extraordinary. It has not happened in the past the way it should, and I'm really pleased to say that this is indeed a new day for New York. So with that, I'll be happy to take any questions.
Governor, given the situation with SUNY and CUNY schools, is there still a vaccination mandate in effect for those schools? And if so, what is the moral justification, given that we have now known for weeks at this point that vaccination doesn't prevent transmission?
Well, we are not standing by that assumption. I'm not sure the genesis of that information. Dr. Bass, you want to comment on that?
Sure. I think it's going a little too far to say that vaccination is worthless for transmission, if that was your implication. We believe that it does protect people from transmission, but the most important thing it does is protect people from serious illness, meaning hospitalization and even death. So people who are vaccinated are less likely to become infected, but the protection is not as great as the protection that we see against hospitalization or death. There, the data are incontrovertible, including the importance of boosting. At this point, about 50% of adults are boosted. We really need that proportion to go up. It's really important to still keep talking about the importance of vaccination.
Thank you.
What you just said, is it still necessary to have that mandate at SUNY and CUNY schools, as we're sort of unregulating pretty much every other area statewide?
We are certainly looking at all these areas. That's why we asked for a little bit of time to be able to assess. Today is about school masks. This is in response to the CDC, and we're certainly going to get to a place where that will not be a requirement. But I want to say, if you ask any SUNY or CUNY student who had to learn remotely for a year and a half, they are very happy that we had requirements in place that had created the environment, even when the numbers were increasing, that their learning would not be disruptive. And I know that that is a positive outgrowth of us having that requirement in place. And again, as the doctor said, reminding everyone that it didn't prevent transmission, but that is why our hospitalizations have been on a rapid decline as more people are getting vaccinated. A state like New York has at least 95% of our residents with one dose. That is fortification more than someone who doesn't. You want to look at the number of people who are in hospitals and do an analysis, those who are in for COVID only, those are still vastly unvaccinated individuals. Vaccinated ones are not the ones filling our beds.
Governor, Stella Porter from WNYT. Superintendents across the area have been asking for a finite metric when it comes to dropping or bringing back masks. Will you issue any sort of finite metric?
I believe we have been very clear in all the metrics, data, variables that we were going to look at in terms of making the decision today. We've laid it out. We watched the numbers trend. We talked about infection rates. We talked about listening to the experts. We just talked to all the leaders in the educational community. They are very satisfied with the idea, the decision that we would have them stop on this Wednesday. And in terms of reestablishing masks again, that is an area where we hope that people continue to get vaccinated, continue to protect their health, continue to be tested. If a student tests tomorrow positive because we sent home a test kit with them, that child needs to stay home and to be isolated for a few more days until they recover. We have to make sure that those are continuing to be followed. So we have said all along, there's not going to be one specific number because it's a combination of many factors as we've laid out continuously.
Governor, some superintendents across the state had also sent a letter to you on Friday asking to reevaluate the mask mandate and drop that in the schools. Did that have any influence or impact on the decision you made for today?
I've been receiving letters like that since August 27th. And if you saw that spike of how many cases we had, I'm really glad that we didn't succumb to any of the political winds or the pressures or all the factors that were out there, other than being clear-eyed and looking at the data and listening to the experts. That is why today we were able to say this is the time to eliminate those barriers. And as I said before, it's two more factors. It was not a letter we received, with all due respect, it's not a letter. It is the fact that we'd already been on this path. We had talked about this January 25th when I said a month from now, our children will be on break. Let's see if the numbers hold. Let's see all these factors I already spoke about, if they hold, and they have held. And we said we wanted to get test kits to students. The children will be tested tomorrow because of our effort, before they go into school. And on top of that was the CDC decision late in the day Friday. So those were the only variables that we considered. Again, we appreciate the input of everyone, but a few superintendents have an opinion, but the head of the entire School Superintendents Association for the state of New York supports what we're doing.
Governor, coming out of the pandemic, some people still feel somewhat financially insecure, and a lot of members of your party have called for you to support the Good Cause Eviction Bill, and one of your primary opponents, Tamani Williams, has repeatedly come out in favor of that. I know you don't negotiate legislation at press conferences, but do you have a position or a leaning on that one way or the other?
I think you answered the question that I would have given you. Again, I'm not entertaining political issues in this forum, and this is very serious. We're talking about what's happening, an assault on our democracy, half a world away. We're talking about that. We're talking about an important turning point in our war against COVID. So that's what I'm focused on, and all those discussions about COVID relief for individuals will continue with the legislators. But I assure you that by the end of March, or shortly thereafter, we'll have a budget that'll explain our position on all those. But I have done more for any individual who've been hit hard by this pandemic than any governor in the state, in this entire country. What we did on the first week of September when the eviction moratorium was to expire nationwide, I said, no, we have to wait. Let's get the $2 billion out to people. They have not had the benefit of the ability to have this money that was planned by Congress to get in their hands, but before my time here was not out in the hands of people to give to the landlords. So therefore, no other governor did this, but we extended the eviction moratorium until January 15th, whereas every other state had stopped it at that time. So I think my credentials and positions in terms of protecting people during this pandemic are very clear and established. Any other questions?
Yes,
Okay.
yes, ma'am. Good afternoon, Governor. We're going to jump over to Zoom right now. Michelle Bocanegra from Politico is your first question. Michelle, your mic is open.
Hi, Governor. How are you?
Great, thanks.
So 2 questions for you. So I just want to understand a little more how school districts might fit into this. So can school districts that, for one, might span multiple counties impose their own mask rules independent of county or city health governments, health departments rather? And also, just to follow up on that, can school districts or even individual schools within those districts also choose to potentially adopt more restrictive rules, even if the county or city health department guidance isn't necessarily to mask up in schools?
My position is to empower the local governments to make the decisions for their entire county. But I've always said that if there are entities within an organization, whether it's a city, a school district, a school, if they choose to be more restrictive, we will not prohibit that whatsoever. In fact, New York City had different requirements. I think New York City will be with us in the timing of this. But for example, we allowed children to be unmasked outdoors. The city of New York just lifted that. That has always been our policy. So we will always allow an entity, whether it's a municipality or a school district or an individual school, to be more restrictive because they're the ones who know best what their students need. And certainly if they see an increase in cases, we'd very much encourage them to do that. Dr. Bassett?
The one addendum I'd make to that is some things that require resources, we really want to be careful that we don't have variation in the types of protections that are available to students based on resources, specifically testing. And that's why the state has been providing test kits to schools. You saw the numbers. We prefer to see that as a county-wide decision because we don't want to see some children with better resource schools have access to testing, for example, and other schools not able to do that simply because of resources. Policy decisions should be made at county government level, but they shouldn't vary by school according to the resources that school has. It's an equity issue.
Right, certainly making sure that they have the resources, of course. And we're going to keep getting the testing kits out and providing vaccination pop-ups. And we encourage schools to create that opportunity for us to come in and literally do a vaccination pop-up and continue providing exactly as Dr. Bassett said. So there's no disparity in the assets available for the schools, but if they choose to be more restrictive, that is their option.
Thank you, Governor. Your next question comes from Kevin Dugan of AM New York Metro. Kevin, your mic is open.
Hi, Governor. How are you?
Good, Kevin, how are you?
Doing good, thanks. I wanted to follow up on your executive order targeting Russian business. I wanted to see there was some other demands. I saw Manhattan Borough President Mark Levine ask for the seizure of oligarchs' assets, many of which are in New York City. I was wondering if you could get behind that, or how do you think the state should target assets by Russian companies and owners?
We are certainly looking at all of our options, is what I'll tell you. And then if there's an action to be taken, you'll certainly know about it, but the individuals who are targeted will know beforehand. What I did today was to take an affirmative action related to any state activity related to Russia or Putin to send a strong message where our priorities are, and they're with the Ukrainian people and the country of Ukraine, and to make sure that we are not spending any taxpayer dollars in support of propping up that regime. And we'll continue to assess that, but the issue you raised is to talk about specific assets. We are actually in conversation with our leaders of our banking community and other places we can have an impact. Again, I'm not going to squander the fact that the state of New York has a larger economy than Russia. And what we do will hopefully have an impact collectively with what President Biden is doing, as well as other states who want to stand in solidarity and speak with one voice behind our president and how we reject what Putin and Russia are attempting to do, and that is to undermine the foundation of democracy, undermining a democratically elected government, which, as we see, we'll stand up to assaults, whether it's in our own country or in other countries.
Thank you, Governor. Your last question this afternoon comes from Bobby Calvin of the Associated Press. Bobby, your mic is open.
Yeah, hi, Governor. Just wanted to follow up on your answer about New York City. You said that you expect New York City to implement its own measures by Wednesday as well. What kind of conversation have you had with Mayor Adams? And, I mean, are you certain that the city will follow suit on Wednesday?
I don't speak for the mayor. We spoke today. You can certainly ask him his position. I feel confident, but I think you want to hear that from the mayor out of deference to him.
Okay. But, I mean, I would imagine that there were conversations before, considering that New York City does have 1 million, nearly half of the state's school population. Would you have done it if he had not be willing to do it yet?
Oh, because this is a statewide decision. So as I gave an example, that the city of New York has the power, as does any city or any entity in the state of New York, to be more restrictive than the state. So we will be lifting this. We have been in conversation with the city of New York, but if they want to have, if they wanted to continue them longer, that is certainly their prerogative. But I represent 20 million people of the state of New York, and this is the position we're taking here. But certainly in consultation with the mayor, I spoke to many leaders across the state to talk about letting them know what we're looking to do. And I anticipate they'll follow, but I don't have control over that. They want to be more restricted. But I will tell you the statewide requirements will apply to everyone. If the city wants to continue their own policy, more restrictive, not less restricted. No entity can be less restrictive than what the state of New York is doing. So that's the flexibility that's out there. So I think you'll be hearing, you can speak to the mayor on this, but we do speak all the time, including today. All right, thanks for coming out, everybody. Appreciate your time on a Sunday.